Have you ever wondered if you've done something secretly in the hospital that made your nurse nervous? You actually think the nurse didn't notice, but he or she noticed everything and took note of everything that you did, and it made him or her very nervous. Most people think that nurses actually get scared mainly because of the alarms or the monitors going off, but most of the time it's those subtle, quiet things that nurses pay attention to that the patients and the family members have no idea, but these keep the nurses' antennas up and alert and on a ready to go mode. So in today's episode, we're going to take you behind the scenes of some of the things that a patient say or do that makes the nurse very nervous.
Welcome to Married to Nursing,
the podcast where we pull back the curtain on healthcare.
Hello everyone, welcome back to Married to Nursing. I'm Anna and this is my husband.
I'm Armand.
Yes, we have been nurses for over decades, and I, in the past couple of years, transitioned into entrepreneurship. Yeah. But my husband is still actively practicing as a nurse, and he loves it.
I do love it.
Yes. So a quick disclaimer before we get started. Everything that we share here on this podcast is for educational and informational purposes only. And any information that we share that may sounds familiar, it's based off of our general experiences as a nurse. So we're not sharing any specific patient information or details. So it's coincidental if it sounds like something that
purely coincidental
are aware of. Okay, are you ready?
I'm ready. Let's do this.
I think this is going to be quite interesting because I know that a lot of people, patients and family members, don't often know that there's some things that they say that just make their nurse's antenna go like, whoa, paying attention to those things. And I know that you've had experiences and I've had as well, but let's get into the discussion. So right away, what is one of the main thing that, in your opinion, that a patient would say that immediately sends off an alarm in your head as a nurse?
Wow. Well, I guess the simplest way to answer this is a patient saying, I feel funny. Okay. Funny. It could be a different variation of saying the same thing, but when a patient says, I feel funny, then your antennas goes up and you have to investigate. What do you mean by funny? Funny can mean a lot of different things. So you start digging. You do a quick assessment. As a nurse, we talk about we do a head to toe assessment. What's going on? Did anything change from the moment you receive the patient during your shift that morning or that evening to the moment where the patient is saying, I feel funny? And you can even go further. You carry your computer, all your equipment. You sit in front of the patient room, just keep watching, observing, making sure that the funny doesn't turn into something that...
And you call the PCA right away and say, come do this vitals. Well, you worked in the IMU, so you had the patient hooked up to the monitor. But...
So the good thing about the monitor is you can change the time, the frequency of the vital sign checks, right? So if you had it on every 2 hours, patients say, I feel funny. Now we're doing it every 10 to 15 minutes. They might not like it, but you shouldn't have said you feel funny. I'm just kidding. But no, we take those things very seriously because we are dealing with people's life, and saying that I feel funny, it sounds just, it can just be, nothing, but it could be something.
Right.
So it could be something that is what we're trying to avoid. We want to make sure that, you go home to your loved one just the way you came.
You get discharged from the hospital. In the best care and the best health that
you can, so you can continue living your life.
And this is also usually when the nurse, the patient's nurse, will camp out in front of the patient's room. They will bring their computer and stay there because they want to be able to keep an eye on this patient and make sure that everything is fine.
And then when your shifts end and you are giving report, you mention that to the incoming person, like, this patient was doing just fine, and all of a sudden they started saying these type of things. So they can also watch and make sure you do fine, you do well, and have a nice stay in the hospital.
Okay, so now let's talk about the flip of it when patient now says, "Oh, I feel fine now." Like maybe they just had a experience something that's about to be an emergency or something, a crisis or whatever, and all of a sudden it's almost as if they recovered quicker than you expected, and they're like, "Oh, I feel fine now. Like I'm okay."
Yeah, that I feel fine now.
Why is that?
The word now, oh, is can be scary because when a patient had a critical situation and then they recover and they say those words like "I feel fine now." Unfortunately, sometimes is a precursor to something else about to happen. It's like the calm before the storm, like we talked about in the previous episode. Your antennas goes up again. You keep watching because there is like it's kind of weird, but there is like this boost of energy patient will get before they crash, or a person will get before they crash. So during that boost of energy, it's like, oh, okay, everything is fine. They even like, okay, I want to get up and take a shower. They will like, they feel like, okay, I'm super hungry, want to eat everything, but it could be nothing, but at the same time, it could be something.
More often than not, it's something like.
And those type of things sometimes scares nurses because they're like, okay, what is about to happen now?
Right.
And your vigilance just goes up. You just watch over that person like a hawk,
right,
until the storm goes by.
Right.
Yeah.
It kind of reminds me of I'm going to use this analogy, like a pregnant woman. Usually they say that when a pregnant woman gets close to her delivery date, she gets this burst of energy, that she's able to start cleaning, prepping, doing all of this. And that burst of energy now goes, and it's almost like she crashes, like, okay, she's now exhausted and, spent and everything. So, yeah. So have you ever had a patient do something unexpected that made you think this could go bad really fast?
Oh, yeah. I'll answer this question using an example, a little story, where a patient came in very critical. We work and we brought the patient down, but unfortunately during stabilizing the patient, the treatment, the patient was sweating, so very sweaty. So the patient wanted to take a shower, and that's a dangerous thing because in this instance the patient insulin was super high. We brought it down, right? We brought it down, and it's critical when you're bringing down a patient. If you don't pay attention to the amount of medication, or even you can pay attention, but getting up and going to a shower, take a shower, blood sugar can drop, right? Because the patient has some medication in the system, and you drop in the shower, fall, can break a bone.
Right. Just a bone. It can bump your head.
Exactly.
Get a concussion or something.
Exactly. So this particular patient wanted to take a shower bath, and I felt for him because those treatment made a patient sweat and make a person sweat.
Okay.
So this patient was mad that I've been sweating all day long and I just need to take a shower. And I'm like, I can't let you go to go take a shower. The patient got mad and left anyway. I camped in front of that shower. I can't go in the shower with the patient, so I just camped.
You just stay there.
I stayed there for however long. I had to let everybody else know this is what is happening so they can watch my other patient. But I stayed there until the patient was done. Make sure that the patient was safe, and go back into the bed.
But could you have, because if you are camped outside because you couldn't go in with the patient, if the patient happened to fall, what could you do, or what you can prevent the fall and at that instant?
So in those instances, if we cannot go, there are situations where we go in the shower with the patient.
Right.
We go. But this particular patient, I could not go in because the patient didn't want me to.
Right.
Right. And as a question of privacy and dignity and all those things. So the best I can do, and I document, hey, patients say no, can come to the shower, and I document what I did. I stay in front of the shower to catch them.
Yes.
If anything happened.
Right. And I think it's important to make this comment here that that's one thing that nurses do a lot that patients and family members don't know is the documentation that happens behind the scenes. Because I remember in nursing school, they'll say if it's not documented,
it's not done.
Because it's the documentation that would be your evidence of what you did or didn't do.
Yeah.
And I want us to talk about falls in the hospital, because that's one of the big things that hospitals are, or just healthcare professionals pay attention to, because a fall in the hospital can lead to more complications.
Yeah.
So when the nurses are telling the patient, put on your socks or call before you get out of bed, or don't get out of bed by yourself, make sure we're in the room, and they're not following these directions, they almost think that the nurse is just trying to keep them hostage or control them. I want you to speak on the importance of following these protocols and the why these things are in place, or why nurses go on high alert.
Fall prevention is very critical, because a patient can fall and break a bone, have a concussion, break the cranium and the skull, and lead to bleeding inside the brain, and a patient can deteriorate. Patient deteriorate from the consequences of fall very quickly. God forbid, a patient fall and broke a bone. Then that means you have to go to surgery, which is going to extend the recovery. You have to go to physical therapy. So the cascade of event that follows a fall is so many, and especially in the elderly population, a fall can lead to...
It can be catastrophic.
It can be totally catastrophic.
Hey, Anna here, asking you for a big favor. We need your help. In order for us to grow here on YouTube, we need you to subscribe if you haven't done so. That will really help the algorithm push the video out in front of more people who can benefit from the conversations, the topics that we'll have here on this podcast. So if you know someone who has been a patient, a caregiver, or a family member that you know who has been a patient in the hospital or across the healthcare system, please share the podcast with them as well. And if any episode that you're watching resonates deeply with you, I want to encourage you to also like the video. But first of all, start by subscribing to this channel, to this podcast, if you haven't done so already. That would really help us out to get these videos, these conversations in the view of more people, and to help the algorithm. So thank you so much. We truly, truly appreciate your help and your support, and we do not take it for granted. Now, let's get back into today's episode.
So everything that a nurse does to prevent fall is for the sake of the patient.
Right.
We're not trying to control you. We put on the bed alarm. I have a patient who, they know where the alarm is and they will turn it off themselves. Yes. We have to look at different things, like beds in the hospital. Some of them have 4 side rails.
Right.
As a nurse, you can't put all 4 because it has legal ramifications.
Yes.
You wish you could. You wish you could, right? It has legal ramification. And not only that, if you put all side rails and the patient is confused and climb out and fall. So we put mats on the floor. We put bed alarm. We have sitters. We have patient will stay in the room with
the sitter will stay in the room.
The sitter will stay in the room with the patient for the entire duration of the hospital visit. Nowadays, with technologies, perhaps AI and all that, they have cameras in the room now, in certain hospitals' room, that observe the patient in the bed and movement. And before...
Doesn't that bring concerns of privacy?
I don't think so. I can't speak on that because I don't know all the ramifications behind it. But I work in a place where they were introducing that technology.
Okay.
They have... Well, I don't think it does, because cameras in the room, they are just focusing on the patient. They just watch the patient in the bed, and they have observer monitoring those cameras somewhere else in the hospital. So if the patient is trying to climb out, they will they will click the alarm to kind of alert the patient, hey, don't do that, or they tell the patient, don't get up. As they are doing that, they are calling the nurse, say, hey, your patient is trying to climb out of bed, and then you rush into the room.
Yeah, I remember when those bed alarms go off, everyone is running into their room because patients don't understand, and family members, caregivers don't understand the ramifications of a fall. Not only, like you just described, on the patient, but even as the nurse. The nurse gets a lot of the blame, the blame. Why did your patient fall? And there's a lot of documentations that now go into this, a lot of investigation, because it also costs the hospital money. So it's everyone lose when a patient falls, in that case.
Early in my nursing career, where I had a patient that fell, and the next day they called me. It surprised me because I was like, oh, they have to debrief and investigate. And I'm like, what did I do? I was so scared, and they were like, no, we just want to find out what happened. Back then I didn't know anything about root cause analysis or what can be done to prevent the next fall and things like that. But as a new nurse, going for those interviews can be very nerve-wracking.
Right.
And then you come back a changed person.
a changed nurse.
A changed individual. You never want to experience those type of encounters again. But for I think I'm kind of glad that they have like better technologies now, because the other problem is the shortage of nurses, right? We can't be everywhere. When you work in a med-surg unit, you have 6 patients. You can't be in every room. Sometimes they can't put sitter in every room because there's no enough manpower to do all that.
And to clarify, sitters are usually for confused patients.
Yes, exactly. Sitters are usually for confused patients. And they will pull a PCT, a patient care assistant, to go sit, which decrease the manpower to take care of everybody else.
So now the nurse has to do the job of the PCA as well as his or her job.
Exactly.
As a nurse, yes.
Because of a confused patient and for the fear of fall.
Right.
So it's not it's a very delicate situation.
All right. So going back to what patients do or say that puts the nurse on high alert, one of the other things that they do is when they become very quiet all of a sudden or unusually restless. Why does the nurse get concerned when that happens, when a patient suddenly becomes very quiet or unusually restless?
Okay, so the patient is all of a sudden very quiet. My concern is, what is happening? Why are you all of a sudden quiet? And I will start questioning the patient, like, what's going on? Are they feeling some type of way? Are they feeling some type of
But besides questioning the patient, what is it why a nurse is concerned about that? So you're talking about the assessment, but I want to know why nurses are concerned about the patient is quiet. What if, I'm just a quiet person?
The quietness can be a trigger for many things, well, not for many things, but for the main thing that we're always worried about, patient going down. Okay. So though sometimes patient being quiet is a good thing because you don't have anything to worry about, but at the same time, being quiet is like, oh no, why are you quiet? So your senses,
before the storm.
your antennas goes up, and you start like, okay, paying closer attention to that patient, making sure that nothing is nothing unpreventable happens. And the second aspect is patient is becoming restless. Restlessness is a sign of respiratory distress. What I mean is patient not breathing well, like just all of a sudden breathing fast, and or patient will be like, I can't breathe, or I feel like I can catch my breath.
Or my chest and my heart is
beating fast. And you will see
my chest.
A patient do something we call trashing, which is like pulling up cover, just trying to almost like, if I take off this extra cover, then I'll get more air. That like it can turn into an emergency very quickly. So you run into that room, or you stay in that room, and do whatever you have to do to get the patient back to a certain level of comfort. Yeah.
Right.
Mm-hmm.
So you have to be able to pick it up as the patient's nurse to know, okay, quietness is good, but is that normal for this patient?
Yeah.
As well as the restlessness, like, is that?
I think one very important thing nurses do is observing and reading different little signs. You know, it's not just about labs, results, vital sign, medication, diagnosis, but it's a lot of observation, because a lot of deduction that nurses do, a lot of conclusion nurses come from those observations, which are not, regular signs of, which are signs instead of, vital sign is this, blood pressure is that. You need to give medication.
That's where the critical thinking skills of a nurse comes into play.
Exactly.
It's not just the textbook nursing, but the critical thinking skills. All right, so now let's talk about family members. Like, you have the family members in the room with the patients, and which is fine. Family can visit patients and stay with them throughout their stay in the hospital. But what are some mistakes that these patients with their family members make that can unintentionally put the patient in harm's way while they're in the hospital?
So, okay, we can look at that in multiple different ways. I guess number one would be a patient that doesn't want to stay in a hospital, and then the family member accommodate that,
supporting it,
encouraging it, and wanting to take the patient home. If a person comes to the hospital, it doesn't mean something is wrong, right? And if they don't want to be there, and let's say we haven't figured out everything that is going on, and they want to leave, what do you think is going to happen when they go home?
Go home, yes. It's going to be worse.
It's going to be worse. Number two, letting the patient eat things that they're not supposed to eat.
That's a big one. That is a big one.
Nobody likes hospital food. And patient, of course.
Well, I liked hospital's food when I gave birth. The hospital food that they had was really good.
That's different. When you give birth, you're healthy when you come to the hospital. You're going to give her birth, right? And they will give you whatever you want to eat. But if a patient's medical condition requires a certain diet, right? We watch that. You can only eat certain food, right? And people will sneak in food for the loved one, right? And it's not good,
right?
Let's say a person is going to go to surgery, and we put the patient NPO, which is nothing by mouth, for a certain hour. Then you snuck food in, and they eat it. Surgery is not going to happen.
And even something minor like giving them water or a sip of, because and to be fair, I understand. I can imagine being a family member and seeing my loved one in the bed and saying, I'm so thirsty, I need water, I need this. And, you just feel like, okay, let me just a little sip won't hurt, just a little sip. But yes, that puts them in harm's way.
We recently canceled a procedure because the patient drunk. I wanted to go. I'm sorry, I'm laughing. It's not funny, but I was so surprised. I was baffled. I went to go pick up the patient, doing my interview and all those things, and I noticed an empty bottle of water, and I was like, "Did you drink water?" And the patient is like, "Yeah." I'm like, "What?"
Why?
In my head, I'm like, "Why?" So patient was like, "Well, I don't know. I'm not supposed to."
Well, did they not explain to him or her that he's supposed to be NPO?
We explained that. So I don't know if the patient forgot that they were supposed to. And the thing is, I was so baffled. I'm like, how much water? He said, just a little bit. I'm like, no, how much water? He said, the whole bottle. It's like, whoa.
So you had to cancel.
We had to cancel. And that particular patient was waiting almost for a while to do that surgery. And the thing is, the surgeon wasn't going to be available again the next day.
My.
Right.
So now they have to wait some more. So the care is delayed. Well, thank God it wasn't an emergency surgery.
Exactly.
Wow.
Yeah.
Well, Dad, do you have anything else that you want to add?
No, I think we this one we talk about it. There is always more we can talk about, but
There's
you know,
so many stories.
so many stories.
Yeah. That's why in the next episode, we're going to be actually going behind the scenes, sharing stories of the craziest things that we've seen or patients that we've taken care of. And we're going to share some of those stories. Yeah. But for now, that is it for this episode. If you have any questions, comments, concerns, please leave them in the comment section if you're watching this on YouTube. Also, feel free to send us an email. The email address is in the podcast show notes or in the caption on YouTube. But thank you so much for joining us on today's episode. Hope you were better informed and you gained some insight into nursing care in the hospital so you can be a better advocate for yourself or for your loved one that is a patient. If you're watching this on YouTube, please subscribe to this podcast, to this channel. Yep. That really helps us grow and get more people informed and involved in their healthcare to make better decisions for their healthcare. Give this episode a thumbs up as well. And if you're listening in on Spotify or Apple Podcasts or wherever else you get your podcasts, please be sure to follow and leave us a review if you're able to. We greatly appreciate it. But until next time, take care of yourself and we'll see you here for the next episode. Okay?
Bye.
Bye.